Hi, my name is Jim Kuchenbecker, and I'm happy to talk to you today about my wearable assist device to improve visual function following restorative therapy. Humans are visually dependent species. We take this for granted how much we depend on vision to read books, to experience nature and art, but most importantly, also how to navigate in our complex world. People who suffer retinal degeneration will experience visual impairment because the cells that are lost in the degeneration do not have the capacity to regenerate. To illustrate this point on the left, I'm showing you a cartoon of the retina, and the elongated cells that are disappearing are the cones and the rods. They die first and the retina thins. On the right is a time-lapse movie created in rabbit retina that is also undergoing a retinal degeneration, and you can see the same pattern there too. In medical research, potential solutions to replace the lost light sensitivity follow three main categories. There are groups that are focused on sparking regrowth of the photoreceptors via stem cell, others who pair biology with in silico electrical driver arrays, and yet others who are trying to restore light sensitivity to the remaining cells in the retina via photoswitch or other drug compounds. The project's deliverable is a wearable intended to serve as an interface between the researchers and patients, but ultimately the goal is to improve the quality of life of the patient. The device, though, will still have utility benefiting those who are early to mid stages of blindness too, analogous to hearing aids. We intend to accomplish this improved benefit by using engineering approach to return signal processing that is lost compared to healthy retina. One of the first things that the wearable can provide is the return of light adaptation mechanism, which had been performed by the cones. Here you can see images of common places we experience placed on a log scale, which shows the number of photons at those locations. Quite surprisingly, it's over 10 to the 10th that we have viable vision. But a modern camera coupled with our algorithm can adjust gains to compress the data and provide the pertinent scene features to the wearer across a wide range. Efforts to restore light sensitivity that rely on drugs, such as KIO-301, a drug in phase 2 clinical trial being developed by Kiora Pharmaceuticals, has precise minimum activation and saturation energies as shown by this curve on the left. Also, this action spectrum on the right says that it's only really listening to the blue photons and not listening to greens or reds. So in their case, our wearable can be carefully calibrated both intensity and in spectral output to maximally drive the molecule. And to quantitatively validate that the system is beneficial, Kiora Pharmaceuticals has provided access to their off-label subjects. These are subjects who had received placebo in an earlier phase and now optionally want the drug. So using the desktop device that you see here, we will test each individual with and without the device on standard tests like you see below, which will provide paired statistical data. Thank you for listening.